Bones. This is Sherry Pope. We are registered kinesiologists in British Columbia, and we are really excited to bring you guys some fitness guidelines to go with the rest of the Prehab project videos you are going to see.
Hi, I'm Debbie Belanger. I'm with Active Living Services, and I'm actually going to be having a hip replacement done at some point. I am on the list, and so this is why we've chosen me to do some of the level 1 demonstrations for you today.
First of all, we just want to cover what general fitness guidelines are. The Canadian Physical Activity Guide recommends 150 minutes of moderate to vigorous aerobic activity every week. And this can be anything from biking, swimming, walks, and you can do this in small increments to start of 5 minutes or 10 minutes and slowly work your way up.
While you are doing your cardio exercise, there is something called the talk test that you can do to just see how hard you're going. So you should always be able to talk with someone. You should be a little bit out of breath, but you shouldn't be like panting and gasping for air. For the weights, we do recommend doing weight training, or sometimes you won't be using weights, but resistance training it's called, 2 times a week to maintain your posture, your balance, your muscle, your bone strength. Start with 2 days a week and then gradually progress into 3 times a week, but you want to make sure you have at least 1 or 2 rest days in between, especially if your muscles are getting sore. We're going to show you some exercises throughout the videos that you'll see. You want to do about 8 to 15 repetitions, which is just kind of one of the exercises, times 1 to start. And then as you get better and you get in better shape and that becomes too easy, you can gradually work that up to 2, and then 3 sets of the 8 to 15 repetitions.
Okay. And some of the videos will have versions of stretching, and we'll also show you a link later on. And when you're stretching, you can do this daily. Easiest usually when you're just waking up in the morning in bed or later in the afternoon to break up your day. Stretches you can hold for about 20 seconds to start, and you can work up to holding them longer to 30 to 45.
Stretching should always be gentle, so you never want to push into pain with stretching, which leads into our next point, which is pain tolerance. So you want to work within the limits of your pain no matter what you're doing. You should always be able to breathe. You should never find that your breath catches because it hurts. You'll feel a little bit of pain, especially if it's around that joint that you're going to have replaced or another one that may be injured, but you don't want that to be too much. So work within your pain tolerance. Use ice or heat or both. Whatever is the best to allow you to control that pain is the methods that you should be using, and you can talk to your healthcare providers to figure out what works best for you as well.
Alright, each of our prehab videos are divided up into 3 levels. Level 1, level 2, and level 3. And it's important that you start at level 1 and then wait to the next day and see how you feel, and then you can kind of judge if level 1 is the correct level for you or if you would need to go up to level 2.
And we will kind of explain it more when we're in the videos, but there are some stretches in the videos that you can do every day. A lot of the level 1 exercises, if you can do them and they don't cause pain, a lot of them can be done almost every day. Then as you gradually progress to level 2 and level 3, which have harder exercises, are when you're going to want to give yourself a good day off in between, just to allow your muscles to recuperate and not be too sore. Alright, so go find level 1 of whatever prehab you are looking to get into, whether it's knee, hip, or GI. Start at level 1, do it, see how you feel, and like Sherry said, move on to the appropriate level after that.